Hi.
Hello.
My name is Eilís. I'm the CEO of the Asthma Society of Ireland, and we're here today to talk about adult immunisation in Ireland and the importance of prevention through vaccination, and of course the growing role of RSV vaccines in protecting vulnerable adults.
My name is Grainne Murphy. I'm a practice nurse working in Drogheda in County Louth. I have a background as a midwife and I moved into general practice in 2013. I would be very involved in the chronic disease management programme within our service, and it's an ample opportunity for me to be an advocate for my patients, to try and keep them as well as we can, to try and make sure that disease is controlled, whether it be a chronic disease or a preventable disease. And vaccinations is a key part of that, to try and keep our patients healthy, independent and well. Yes, hopefully we can discuss a little bit more about the actual RSV, respiratory syncytial virus. Will be called RSV going forward.
The Asthma Society is particularly interested in this because, first of all, viral infections are the most common trigger for patients with asthma. So from our perspective, the risk of exacerbation for asthma patients is significantly reduced through prevention and vaccination. It's a really critical part of asthma management. Asthma patients can be more susceptible to viral infections, and the complications arising from viral infections for asthma patients can be more serious, and indeed repeated viral infections can cause cell damage and damage to lung function. So from our perspective, it's really a critical topic to cover when we are out speaking to those who use our services and who follow us on social media and through our emails and so on. It's really an important topic for the Asthma Society and for asthma patients across Ireland. I'm really interested, Grainne, to hear about your experience with your interaction with patients, because obviously as the Asthma Society, we are working with a very particular population who are vulnerable to viral infections and vulnerable to serious complications arising from viral infections. And our work, our health promotion work, often involves reminding people to have their vaccinations coming up to this time of year, actually, and to start to get their appointment with their pharmacist or their GP in the diary, and to make sure that they are well prepared for the months ahead. So I'm really interested to hear how your patients have responded to both the suggestion of the vaccinations and actually having them. I wonder, could you share some of your experiences in primary care related to vaccinations and patients?
Yes, I see a lot of patients with chronic disease. So the chronic disease programme involves 2 visits to the clinic most years for my patients. And during that time, I have the opportunity to talk to my patients about being proactive with their health. And part of that will include the vaccinations that are available.
And why is that so important for chronic disease patients?
So I think it's important to be proactive with health, to try. We have an ageing population, and we know that our patients, as they get older, their immune response isn't as good. So we want to try and keep patients as well as they can, that they remain independent, that they're not becoming a burden to their family. And a lot of patients want to be proactive. And if there is a vaccination that is going to keep them well, then, patients like to have a little bit more information. So I will give them some leaflets, I'll give them some basic information, and I let them go away and have a little think about it.
Yeah. And we would hear obviously about, because asthma is part of that chronic disease management programme, we would hear back from patients about their doctors speaking to them about being vaccinated. And really our job in the Asthma Society is to reinforce the message that you're giving to your patients. Because we have, obviously there may be some vaccine hesitancy, may even be vaccine fatigue, following on from the COVID-19 pandemic. But actually what we're seeing now, and I wonder if you're seeing the same, is that particularly with RSV, because it was covered so much in the media, that people are starting to ask questions now again about the vaccinations they should get, and particularly when prompted by the general practice or by organisations like the Asthma Society.
Yeah, it's wonderful that you are trying to get the word out there. My experience is that the patients really don't know about RSV vaccines, and they want the reassurance that they're being proactive with their health. But in my experience, the majority of them, it's the first time they're actually hearing about this when I bring it up with them. So it's great that there is collaboration from other organisations to help get the word out there. So my patients like to be informed, and I have a very interested population that want to stay proactive with their health, and they like to know what vaccinations are available for them. The NIAC, the National Immunisation Advisory Committee, recommend 5 vaccinations for adults over the age of 65. So we have the seasonal flu vaccine, with the pneumonia vaccine, COVID vaccine, and then with shingles and the RSV vaccinations. Only 3 of these vaccinations are receiving funding, any national funding. I have leaflets available for the patients on the various vaccinations that are available. RSV is a respiratory virus. It's not unlike other respiratory viruses that we see. And when a patient presents to us, we don't know what virus they have. They've just got a severe respiratory tract infection. It presents with fever, cough, sore throat, congestion, headache, fatigue, runny nose. We know that the 2 extremes of age are going to put patients more at risk. So your younger patient, the babies particularly, and then our senior population. But we also know that patients that have comorbidities are much more likely to have ongoing issues related to infections. So it's trying to protect our population.
And that's really critical. I mean, from the point of view of asthma patients, it is about, the potential for serious complications, obviously, if they develop or contract a viral infection. But it's also the longer term effects of that, because ultimately there could be cell damage that is created from viral infections, and there can be damage to the lungs over time with the persistent coughing and the persistent inflammation. And of course, the lungs in asthma are so sensitive that they're particularly susceptible to viral infections. So it's really critical that general practice are taking such a strong role in supporting patients to understand how best they can keep well.
Well, we know that vaccinations help keep patients well and out of hospital, especially during the winter months when there is a surge of these viruses. And prevention helps in their long-term health, their mobility, their independence, their overall health, and particularly our older population that may have comorbidities. We know that they are more at risk of long-term complications when they contract virus.
And the Irish population in general will, for decades now, really be very familiar with discussions coming up this time of year and beyond now that the healthcare system is under strain during the winter months, and that viral infections have quite a bit to do with that. So for us in the Asthma Society, we would start to talk to patients about getting their various vaccinations at this stage of the year. But we know that they want to stay out of hospital, and we know that the system needs people to be out of hospital as much as possible. And of course, that's the entire intention and goal of Sláintecare.
Yes.
Is to make sure that people are being treated in the community, that we're not looking at, acute care consistently over the winter months, but rather that people are taking those preventative steps now. Of course, they need the support of the government to do that and to take those preventative actions by reimbursement and financial support around the costs of those vaccinations and immunisations for the younger population.
So in Ireland, we have a strong childhood immunisation programme established, which has proven to be very beneficial. unfortunately, in the adult population, we don't have a structured vaccine programme as of now. The NIAC guidelines recommend 5 vaccinations for all adults. Unfortunately, in my experience, that our patients now have the burden of having to pay for these other 2 vaccines if they want to avail of them.
And do you find that cost is a barrier to getting their vaccines now, the older population for whom reimbursement hasn't been introduced yet?
From my experience, when a patient has experienced a severe respiratory tract infection, whether we know what's caused this, what is viral or bacterial, they certainly don't want to experience this a second time. So I think explaining to a patient that there are options available that are very good to protect them and will, potentially keep them independent at home. So there is a place for the vaccinations. It can be a challenge for the patients to get the money together, particularly if they're on a pension. But I think any patient that actually wants to get these vaccines will find the way to do it.
We did a survey as part of our preparation for our pre-budget submission that we launched recently. So we did a survey among our supporters and followers in the Asthma Society. And as part of that survey, we found that over half the people who responded, 56%, had said that they are struggling to make ends meet at the moment. Now, this is across all ages, so parents of children with asthma and patients of all ages. And 1 in 4 had said that they have foregone their asthma medication in the past 3 months because of the financial constraints in the house. So as much as people are doing their absolute best to stay well, I think, we are certainly hearing reports that cost of medications and indeed vaccinations, it's very likely it's a barrier to accessing those. And, really it makes so little sense because we have, as a society, we're then carrying the burden of cost of hospitalizations, of emergency department visits that may have been avoided. And we also have a patient population who are eager to stay well and to be in work or to be caring for their families, maybe their grandchildren in the older populations, or heading off to sunnier climes at this time of the year. And instead of that, ending up in hospital beds because they haven't had their vaccinations. And I think a combination of both the cost and the knowledge of those vaccinations available to them.
Yeah, I know from the patients that I have vaccinated, we've had several cases of patients that would say to me they've had their best winter. It's just getting the word out there, making them aware of actually what RSV is, to understand that this is a highly contagious virus, that once they have contracted it and they end up possibly being hospitalised, there is no actual treatment. There's no effective treatment for it. So the RSV virus, it presents like any other respiratory tract infection. They'll have cough, fever, sore throat, headache, fatigue. We weren't in a position last year to swab patients in our locality.
Yes.
So when a patient has a respiratory tract infection that warrants hospitalisation, they're going to be in for maybe up to a week. It can be life-changing for them.
And tell me, so you're telling us a little bit about RSV in particular, and we did want to speak about that and the vaccines available for people. But you must have patients who have, could you tell us maybe a little bit more about a patient who's responded well, let's say, to RSV vaccination?
Yeah, so one of my patients, Bernadette, has agreed to talk about her experience. She is a very healthy, well lady, and she wants to stay well so she can be involved with her family, that she can continue to enjoy her life and remain as independent as she can. So she's had a few episodes of respiratory tract infections over the years, and when I mentioned to her about having the vaccination, she was very keen to take it. So she's had a very good winter. She said probably her best winter that she's had for many years.
Isn't that
It's wonderful. And that's what you want to see for your patients. Yeah.
We in the Asthma Society, we keep an eye on the numbers of deaths caused by asthma every year. And pretty much all of our work really is focused on keeping people well and ending fatalities or preventable fatalities in asthma, as you can imagine. And in 2022, they're the most recent CSO figures available. 87 people died from asthma. And that's a 36% increase from the previous 3 years, which were down in the 60s. And it's looking like from preliminary CSO data that actually the figures are staying the same and even gone up to 92, 93 in 2024. So we're seeing a worrying trend in deaths caused by asthma. And the majority of those deaths are happening to women in their 70s. So it's really critical that we prioritise that population. You know, if we see that those figures are growing and we know the people who are most vulnerable, we should absolutely be doing everything we can. And the work that you're doing in introducing those vaccinations is part of that, isn't it?
Yeah. Well, we know that age itself is a risk factor for the older population. We know that their immune system isn't as strong. So when they contract viruses, it's a much harder journey for them to try and recover. And it may have long-term implications, particularly if they have other comorbidities. So I think being proactive with the health, and we know this, the RSV vaccinations are very effective to reduce the risk of contracting this virus.
So Grainne, will you tell me a little bit about what people can expect when they go into you? And you're telling them about the RSV vaccines that are available. What should people expect?
So I'm going to give the patients the data. I will let them take that information away. I go through signs and symptoms of RSV, what it is. You know, I will tell them the efficacy of the vaccines and the data and the research that has been done on these vaccinations that are available. I'll then allow my patient, they may or may not make a decision. So I have a role in the chronic disease management. So I would see my patients that have already established disease. They might be diabetic, they might have cardiovascular disease, they might have immunocompromised. These would all increase the risk if they contracted a virus. So during my consultation with my patients, which is twice a year, they will come and see me. I will try and strongly encourage them to consider vaccinations as being primary prevention. The patients that have underlying asthma, they'll also present to me. I will do spirometry on them. I will check their symptom control. I will check to see how they're using their inhalers. But I would strongly encourage them to be proactive with their vaccinations. Or they may want to go away and talk to the family members and maybe do a little bit more research. If a patient wants to order a vaccination, I'm going through, what they can expect after the vaccination, post-vaccine advice. And I will tell them that I'm at the end of the phone if they need some further information. So a lot of the patients will take the information away. They want to discuss it with the family members, and then they'll come back. They'll touch base with me to place an order for the vaccination. I do tell them they can also have this vaccination via the pharmacy if they wish. That there are other options if they prefer. But a lot of patients will like to keep all the medical information in one place.
Right. And they're paying you when they come into the surgery to receive one of the vaccines.
Yes. They have to have the funds for it. But, I explain to patients that we know that the data on the vaccinations extend beyond 1 year. So, when patients are looking to maybe purchase the vaccination, I suggest to them maybe they talk to the family members if they're looking to purchase maybe a gift for them. It's a good way to protect their senior relative.
Absolutely. And we all want our mums and dads sticking around for as long as possible and to be involved in our lives for as long as possible. And equally, the grannies and granddads for the younger populations. So I would agree with you. It's absolutely critical.
What do you think, Eilís, could be done to raise public awareness about vaccinations? Is there anything else that we could do to help highlight the...
Yeah, I think the introduction of an infant immunisation programme for RSV has been important. And for those who are aware of the impact that immunisation programme has had on saving lives, reducing hospitalisations and reducing the numbers of children in ICU. So the numbers of infants who have been into ICU because of RSV have dropped from 64 in 2023, I believe, down to 5. And of course, you want that now to be extended out to other vulnerable populations.
Yes. Well, we know that the adult population are advised to have their vaccinations, and it's we know that the RSV vaccinations can be given at any time in the year. So I'm trying to encourage my patients maybe to consider this during the summer season when maybe viral count is lower. So we have them well before they approach the winter months when viral load is much higher.
That's really critical. And as I mentioned, in the Asthma Society, across patient organisations, really, we are consistently making sure that seasonal information is being delivered to patients and that patients understand what is needed to keep well over the winter period. But we do also need the government to recognise the importance of this. And what was very impressive was that for the first time, the infant immunisation Pathfinder programme for RSV was introduced and was used as an opportunity to collect data. So for those who may be listening and aren't familiar with the term Pathfinder programme, it's essentially a piloting programme. And it allowed the state to deliver the immunisation programme while collecting data on the benefits of that programme. And we've mentioned some of those benefits already. And so part of our pre-budget submission to government this year was to recommend that a similar programme be introduced for those over 65 when it comes to the RSV vaccines, so that they can introduce the vaccines, the vaccination programme. They can collect the data, which is so critical for us to understand really the benefits of such a vaccination programme for the older populations, but also make sure that we're protecting our healthcare systems while we're doing it by reducing, you would hope,
the number of visits.
The number of ED visits and hospitalisations. Yeah.
Well, I know that by protecting my patients, my job is going to be easier because I know my patients are staying well. And obviously the hospitalisations are key to, maybe budgets as well and funding for hospitalisations.
So really there's the role for the HSE in public awareness campaigns around RSV vaccines, as well now as the immunisation programme for infants. But also there really is an urgency around introducing reimbursement. And of course, organisations like ours and general practices like yours are doing the job of one-to-one awareness raising and of course going out and for us broadcasting as far as we can to those who are interested in staying well over the winter season about how they can do that and the benefits of the RSV vaccines in the same way we would do for flu and COVID-19 and pneumo and so on. And all of those things, you would hope, making sure that people can have a nice jolly Christmas and they're not ending
there
up
as well as we can keep them.
Absolutely.
Yes. RSV poses a significant threat to the older adult, and there's still a lack of awareness out there about this virus. Professor Mitchell, consultant respiratory physician at Tala, has stated that. So we do need to get the message out there that this is a virus that we can protect our patients against.
Yeah, absolutely. Professor Mitchell is one of our medical advisory group members in the Asthma Society, and we've been very lucky to have Professor Mitchell actually speak on our webinars, and that's exactly, one of the topics that he would cover is the importance of vaccination in adults, and specifically now RSV, and making sure that people have a full understanding of that. And of course, as mentioned previously, we need the data to demonstrate the efficacy of RSV vaccination in the Irish population. So the research has been done, the clinical research has been done, of course, but we now need to see it in practice and we need the data collected. But in order to do that, it's got to be an effort by the state and to introduce a Pathfinder programme for the older adults so that we can pilot it, and that vaccines are reimbursed as part of that Pathfinder programme.
In my experience, that I think the decision is down to the funding. Patients, when I tell them the benefits of the vaccinations, they're very keen to do it, but then, there may be a hesitancy when they hear about the cost of it. So it would be wonderful if there was some investment, some funding there. And we know vaccination is going to reduce the burden on the health service.
So we'd like to see really that the RSV vaccines are introduced on the national immunisation programme for those over age 65s. Are there other pieces of work that need to be done to make sure that when it's introduced and added to the national immunisation programme, that people are taking up the offer from the state, and that the reimbursed offer from the state?
Well, I know as a practice nurse, we're in an ideal position to actually advise our patients on a one-to-one about this vaccination if they are considering doing being proactive with their health. But coming from GPs, so my experience, there isn't enough awareness about the vaccinations that are available. And
so if the RSV vaccines were added to the national immunisation programme, by the very act of doing that, GPs are probably more likely to see them as part of the bundle and therefore recommend them to their patients.
Absolutely. And ultimately, it's going to reduce the workload for GPs. If our patients stay well, they're not going to have as many visits to the doctor.
Yeah, and hopefully not wait so long for, to get that appointment that they so critically need. And for patients with a chronic disease or a long-term condition, some of those conditions can be variable. And on the day that you phone the surgery, you may feel very unwell. And, with your usual treatment, you may find that a week later, when you finally got the appointment, that you're feeling actually better and you don't have the same symptoms, and it's not as easy then to assess the patient for you and for the doctor.
That's right. And, when we know that the patient is infectious, they're spreading that virus for between 3 and 8 days. A patient that is immunocompromised is going to be spreading that infection for up to a month. They may not be aware of that, and they're presenting to a surgery, sitting in a waiting room, shedding virus. So we know that patients, the basic hand hygiene, covering their mouth if they're coughing or sneezing, wearing a mask if they have a respiratory infection, is going to reduce the spread of the virus. But patients sometimes will take steps and, maybe forget those basic measures.
And isn't it so important really to remind people, because they would have gotten the message during the COVID-19 pandemic, but it's so important to remind people that actually this isn't just about protecting yourself. It is, it is a form of protecting your own health, but also it's the people around you. And so many grandparents across Ireland now, and so many of the older population, once retired, will end up helping out with childcare during the week, for example. And they're keeping their extended family well too and protected if they've gotten the vaccines.
Absolutely. And, I don't think any of us want to be a burden on our families as we age. And if there's something there we can do to stay healthier and well and independent and to be able to be active in our retirement.
Yes, so many of us actually depend very heavily on the older population to support, particularly if they're, our families at work or their families where there is a chronic illness or a serious illness in the family. The older generation is dependent on to support the wider family very often, and it's important for that they stay well too. And
absolutely,
that we have them around us,
so we can enjoy the senior years in a healthier aging population.
And we do have an ageing population in Ireland, so we're going to see that there is a greater burden on the healthcare system keeping us all well. There are higher rates of chronic disease in our population, rising levels of chronic disease. And so for something that is so clearly and easily preventable within the Irish population, it just makes sense that the state takes the action necessary to make sure that we're all taking our vaccines.
Yes. And I suppose as a healthcare professional, we have a responsibility to try and make that awareness available across the board for all ages. But, as our older population, maybe some of them aren't as involved, they may not have social media where a lot of the younger population are getting their information from. So I think they do rely on that one-to-one interaction with the healthcare professionals. So getting our healthcare professionals educated about, these vaccinations that are proven their value is essential. We don't have a huge burden of a lot of elderly population in our practice, but I would have a significant number of patients that are 50 plus that would have comorbidities. I would advise them that they can have a vaccination against RSV if they're over 50 with additional comorbidities.
I'd agree. So I suppose we've discussed now the benefits of introducing an RSV vaccination programme for older adults. I wonder if you were to speak to policymakers, Grainne, what would you be saying to them about your experience of the RSV vaccination in older adults over the last few months?
Well, I've seen firsthand the benefit of giving the vaccination. I'm trying to encourage the patients to maybe think about RSV vaccinations during the summer season, because I know in another couple of months when the viruses are circulating, there's not that ideal opportunity to give that patient a vaccine when they're well. So it's trying to get the word out there. This is a very good vaccination that can keep them as well as we can. And it's to try and get the word out there as quickly as we can that the patients are, because in my experience, the majority of patients are not aware of RSV. They think this is something that's more significant in the babies, in the infants, but they don't realise it's equally significant in the older population.
I think it's really interesting you were talking there about the reactions to the vaccines. I would hear from our asthma population, there are some patients who have had hesitancy around getting various vaccines now, not necessarily RSV, but we would obviously go out and speak to our patients, and there has been a concern, rarely, but sometimes, mentioned that they will have a respiratory response from getting a vaccine. So it might be the flu or the COVID vaccine that they've gotten before. And really, I'd be interested to hear what you would say about that, because the Asthma Society would be saying really that there may be a very minimal sort of initial response, but actually that the risk of the virus itself is so much more serious than the risk over the the 2 or 3 days afterwards or the week afterwards, where they might be somewhat symptomatic. And of course, they could always talk to you or the GP about how they manage that with their asthma action plan in that interim period.
Yes, I haven't seen anybody with any respiratory symptoms post-vaccination. It's more of a localised reaction. Just, I do tell them to expect that little bit of soreness. They may have a low-grade fever for 24 hours, but I generally encourage them just to have a nice, easy day, drink plenty of water, take paracetamol if they need it, and check in with me if they are concerned.
Yeah, that would be very reassuring, I think, to those with whom we speak, because it is, of course, always a concern for people, and then, feeling very reassured in the longer term.
Yes.
That they've protected themselves against what can be a very nasty viral infection. And you make such an important point, because I think for the majority of the older population, having to end up in hospital for whatever reason, it may be a hip or a knee replacement surgery, it could be anything at all. And of course, they're going into hospital and they're thinking, well, I may come out very well from this, or I may come out with something I didn't want to get at all and I didn't expect.
Yes.
So you make a very good point there, I think, too, around the importance of vaccination to keep yourself healthy for those incidents. And do you find that there are patients who would be resistant or hesitant to receiving more vaccinations following on from the pandemic? Or do you find that people are open to taking them? Probably in the older population, there's a familiarity and an understanding of the importance of vaccination programs that maybe the younger population aren't always as familiar with.
I think as a practice nurse, I've developed a very good relationship with my patients, and that trust is developed over years. So when I'm talking to my patients and trying to keep them as well as possible, this is part of that wellness check. And I think the trust element is there. Yes, there is definitely a vaccine hesitancy with some of the population, and some patients will have an episode of illness where they recover from it. And then there's a kind of well, I got through that episode, I'll be fine.
Oh, yes, of course.
In future. But it's just, Bernadette is a particularly good example of somebody who wants to be there she doesn't want to be a burden on her family. She wants to be, as well as she can, to remain independent at home. She wants to be involved with her grandchildren. And it's very important for her to stay well. So I think she trusted the guidance she got, but she also did her own research.
Yeah.
Yes.
And that trust, of course, is absolutely critical. And it needs to come, the message needs to come from a variety of places for that trust really to be built, I think. We find that that having advice from both medical experts and then from patients themselves who've been through the process, a combination of those two voices can often be exactly what others need to hear in order to really sort of just assuage any concerns that they might have and get them to motivated and good to go, So, yeah, it's absolutely critical that way.
Do you think that Bernadette's story might encourage other patients that you would encounter through the Asthma Society?
I very much hope so. I think, generally speaking, the older population, because they may have seen a period of time in Ireland where there wasn't such broad access to vaccinations and immunisations, that there may be a better understanding and appreciation for the importance of them. But nonetheless, I think at the same time, we do need to constantly reaffirm that message for people. And if somebody, I think you're right too, if somebody has gone through contracting a viral infection, they may not have gotten particularly sick during that viral infection. They've been lucky. And they might assume that actually this isn't so bad. And of course, it very much depends, for example, for asthma patients, on the degree of inflammation in their lungs at any given time. And so where, you might go through one viral infection and not be particularly badly off if the inflammation has become worse and you go, you contract another infection, you may end up with very serious complications.
Absolutely.
And it's making sure that people understand that.
And I think there is a bit of what I call survivor's bias, that they've gotten through it, the winter, and they're fine. But I do try and explain to them that, when an RSV virus is circulating, we're not going to know what they have actually presented to the surgery with. They'll have a virus, but unless we can swab them, we don't know what we need to treat. And we know that there's very effective treatment for patients that present with flu or with pneumonia or with COVID, but we've no actual effective treatment for RSV.
Yes, so that makes it all the more important that people are aware of the vaccination programme available to them, or the vaccines available to them. Thank you for listening to the Innovate for Life series. If you found this episode helpful, please share and look out for other episodes in the series of Life Because of New Medicines.